So Mike, you've had a few injuries from rugby, and currently we've just treated this knee down here, which has been operated on about 4 weeks ago. How's it feeling now compared to when we treated it about sort of 20 minutes ago?
I don't have any actual pains in it at the moment.
Right.
And I've seemed to be able to push it for the bend as I'm bending it there,
Yeah.
and I am not getting the pains in my knee
Yeah.
when I came in.
Yeah.
Yeah, so it seems pretty good.
Yeah, just in terms of a subjective improvement from the 2 or 3 different things we've used on it now.
You mean which one?
What improvement? What improvement have we subjectively? We don't know whether what's done what or exactly whether it has improved it as much as what we think, but just subjectively, what you think the improvement might be between now and when you first walked in here.
It is when I first walked in here. If I pushed my leg to bend it quite hard, I was getting quite a lot of pain to my leg.
Yeah,
now
yeah.
I'm not.
If you pushed your leg to bend it quite hard.
Yeah, yeah. If I was pushed it to bend it like 100 degrees.
Oh, yeah, yeah.
What's that? That's about 90.
Yeah, yeah.
And I'm pushing it to there.
Yeah,
the pain is nowhere near as bad as it was.
Right. Okay. Yeah. So, what sort of improvement would you rate the treatment so far? Do you want to just?
Oh God, it's hard to put a number on it. But basically, the pain. If I push it hard, the pain's probably gone from 5 down to about 1.
Okay.
Yeah.
Right. So maybe about an 80% improve. Oh no, well, hang on.
I can't put a percentage on it,
Yeah,
but it's gone from being, oh shit, that's hard enough, to actually not really noticing it. But how often I have to do that in the day, I've got no idea.
And it seemed like it was the APS, the electrical device, that you were sure. But then we did 2 treatments with the light and the electric acupuncture device beforehand, so we don't really know whether there was a little bit of a delay in those.
I don't know whether it was the electric device or whether it was the little hand electric device.
Okay, yeah.
So I'm just going to try the hand electric device this week, and hopefully when my painkillers wear off in the evening, hopefully the hand electric device is actually going to keep the pain at bay.
Okay.
So I won't know for a few days.
All right. Now, you're talking about when you move your foot sideways, you can quite often feel a lot of this pain quite sharply.
Yeah, well, that's kind of much more, I think, ligament pain.
Yeah.
Rather than scar or specific inside the knee.
Yeah.
Like, I can feel, just twisting it like that, I can feel it's stretching and not too good for it there. But,
so it's still the same when you sort of move your
possibly
leg or
not
foot.
as bad, but I can't, you've got to do it a number of times, I think, and at the end of the week go, oh shit, the pain actually isn't as bad as it was.
So the ideal outcome for you here, or the immediate things you'd like some relief from, is just pain. Pain when you go to bend your knee.
Yeah, pain. Well, there are kind of 2 things. One, I kind of have arthritis in there anyway.
Yeah.
Plus, on top of that, I've got all the actual damage from the operation.
Right.
And so I'm still taking painkillers, but I've reduced those enormously in the last few days. So hopefully, this can actually, when the painkillers wear off towards the end of the day, hopefully what I can do is use the handheld electric device to actually work on my knee, and hopefully that'll mean I won't have to take as many painkillers. And as far as the arthritis and things, I'm not too sure. I mean, possibly it's actually some arthritis effect that I'm feeling as well as muscular problem. I'm not too sure.
Have you got an idea how bad the pain is when the drugs wear off?
Well, it's seriously uncomfortable. You know, like, I mean, I'm not in anything like an 8, 9 or 10, but it's just, you know, I cannot find a comfortable position. We're lying down, standing up, sitting, I'm just really uncomfortable. So I don't know, maybe that's a 3 sort of thing. I mean, I'm nowhere
3 out of 10.
If
10's really bad, then
10's really bad, and 1 and 0's nothing. It's probably a 3.
3 out of 10. Okay. But you're saying seriously uncomfortable or something?
Seriously uncomfortable.
Comfortable,
As opposed to, oh my god, I can't stand the pain. It's like, shit, what do I do with myself?
Okay.
So it's that sort of pain.
Right. Any other injuries that you're clear about that give you regular pain at certain times, or when you move them certain ways?
Occasionally I get tennis elbow, and I've got some back injuries as well that I go to the osteo.
How often do you feel that pain in your back?
Oh, depends what I've been doing. But at night time, quite a bit. Your partner be able to rub that device over there for about 4 or 5 minutes if she's in a good mood? Yeah, if she's in a good mood,
Okay.
So I'll see how that goes,
Yeah.
on my back, and see whether that actually just... I think with the back, it's kind of like old scar tissue close to the spine.
Yeah.
And I think what happens is when you've been doing a lot and you overuse it, it kind of tightens and causes, some pressure on the nerves.
Yep.
So it's nothing unusual.
Okay, I might get you to, if you want to take some of that deep heat aloe away with you and just bring it back as well, so you can try that out a few times. So you've got a whole range of things. You've got the plant to rub on there. So, all right, we'll leave it there, Mike, and hopefully we'll get some benefits towards the end of the week.
All right, thanks, Tom.
So, Mike, last time you came around here about a week ago, and you're having a lot of trouble with this knee down here of yours, where you've had an operation and you've had a reconstruction, and it was giving you a bit of pain, and there's normal problems associated with sort of just the general healing of these things. And we gave you a few treatments with the electric acupuncture device, the APS device, the Boptron light, and threw a few things at it. I think it was the action potential simulation device that seemed to give you a clear response at the end, but you decided that you liked the cute little easy to handle electric acupuncture device, and you took that away and gave yourself a few treatments over the week with it, and used the raw aloe vera plant, rubbed the sap of that in, and you've used the magnets from the biomag.net website, putting on the old south pole, the negative, the green side of the magnet against the painful area. Overall, how's the knee now, about a week later?
A week later, look, it's really hard to actually say exactly which one or what the result, not what the result is, exactly which one has actually helped improvement. It could just be time, it could just be this is now week 5 instead of week 4, which is, I don't know. But I was using the little handheld electric device twice a day in one particular area that really was causing me trouble. Now, as in yesterday, today, really the knee's the least of my problems. Yes, it's swollen, and yes, it's a bit uncomfortable, but basically it's not really that much of a bother to me. The pain in that particular area has gone away.
Right.
I was rubbing aloe vera.
So you're sort of saying you're not having pain in the knee now?
Look, it's uncomfortable in things, probably more because it's swollen than anything else. And yes, occasionally I move it and it bloody hurts if I push it too far or tweak it in the wrong direction, whatever. But just standing here, it's just a little bit uncomfortable, which could probably be more down to being swollen and things than any particular part that actually hurts a lot. So I basically use the aloe vera on a regular basis, and I use the electric handheld device twice a day, and I use the magnets a few times. I can't say which one helped the most, but I tend to think that the electric device may well have helped. The aloe vera, I was rubbing it in. Look, I have no idea chemically what it does inside a knee sort of thing, but this week I'm a hell of a lot better than I was a week ago. So now I'm kind of really focused just on getting off the drugs and keeping the swelling down, and making sure I can give it another week or two before I get aggressive with it.
How would you rate that knee for pain, generally speaking? Say just...
Oh, right now?
Yeah.
I don't know. Just standing here?
Yeah.
I don't know.
Out of 10, 1 out of 10 or less.
It's just basically.
What about that movement you're talking about when you kind of bench it?
No, those sort of things. No, those sort of things are to do with. I think the ligaments that got tightened in the operation. And they take a while, and they can take up to 12 months to actually come right before you get flexibility back. So if you move your leg in an area where you haven't got the stretch. It's going to hurt. And I don't think that's something that treatment solves. I think it's something that basically you just have to keep working at.
I was just wondering whether you might have noticed any small change there at all with the amount that you could move it.
Look, I mean, I'm doing this. I'm kind of turning my foot in where I couldn't do that a week ago. You know, so look, I mean, all up, my knee doesn't hurt as much. It definitely doesn't hurt in this particular area through there. I have no idea what the muscle is, but that was where I used the electric handheld device on it a hell of a lot. And that pain's gone away. Now, as I said at the start, I don't know whether it's just that it's another week, or whether it's the devices, but basically I'm a lot better off today than I was a week ago.
Yep.
Yeah.
Oh, good news, Mike. We'll hope it continues through, and we'll see how things go over the next week as well. And you can always come back anytime.
All right. Thank you for that.
Thanks, Mike. Bye.
Cool.